Good afternoon, participants, and Dr. Rajnikant, sir. We welcome you, sir. Dr. Rajnikant, sir. Am I audible, sir? Please unmute, sir.
Yes, sir.
Hello. Please unmute, sir.
Sir, can you hear me clearly?
Yes, sir.
Yeah. Thank you, sir.
We
Thank you.
welcome you, sir.
Yes, sir. Good afternoon. Yes, sir.
Afternoon. I request Dr. Abhijit, sir, to invite Dr. Rajnikant, sir. Abhijit, sir, please.
Thank you, Dr. Ramkumar, sir. And good afternoon, everyone. And happy Teachers' Day to every respected teachers. You have been a constant guiding light to the youth of our nation. On behalf of Katihar Engineering College, I welcome our speaker, Dr. V. Rajnikant, sir, who is a professor at St. Joseph's College of Engineering, Chennai, in the Department of Electronics and Instrumentation Engineering. He has more than 14 years of full-time teaching experience. He edited many books like Advances in Artificial Intelligence System, Innova Science Publishers USA, Signal and Image Processing Techniques for the Development of Intelligent Healthcare Systems in Springer Nature, and Application of BAT Algorithm and its variants in Springer Nature. He is the author of many renowned books like A Beginner's Guide to Image Multi-Level Thresholding, Biomedical Signal and Image Examination with Entropy-Based Techniques, and Hybrid Image Processing Methods for Medical Image Examinations. All are published in CRC Press, Taylor and Francis Law. Sir is also associate editor of International Journal of Rough Sets and Data Analysis in AGI Global Publisher and International Journal of Quality Control and Standard in Science and Engineering in AGI Global Publishers. He has 5 patents and has been published more than 50 papers in various reputed journals, conferences, and book chapters. His main research interest includes medical imaging, machine learning, and computer-aided diagnosis, as well as data mining. Now, Dr. V. Rajnikant is handed over to you. Thank you.
Yeah. Thank you very much, sir. Thank you. Can you hear my voice clearly, sir?
Yes, sir.
Yes,
Yeah. I thank everyone for the invitation, and I thank Dr. Ram sir for inviting me as one of the session speaker. Okay, thank your college as well as Dr. Ram sir for this opportunity. So I would like to present today. My presentation is regarding MRI assessment and how the MRI can be assessed with various approaches and how the disease which is recorded in MRI can be evaluated using some computer-based algorithms. So thank you very much, sir. Shall I start my session, sir? I request your permission.
Yes, sir.
Yeah.
Yes, sir.
Thank you, sir. Thank you very much. So one minute. Let me. So parallelly, I can demonstrate some MATLAB codes if possible. Okay, I request you to confirm whether can you see it, sir?
Yes, sir. It is
Yeah,
visible.
thank you. Thank you very much, sir. Thank you very much. So today's discussion is regarding the MATLAB supported segmentation of medical images. Okay, particularly here we are interested in extracting some disease infected section from MRI with varied modality. So myself, Rajnikant, currently I'm working in St. Joseph College of Engineering, Chennai. So I thank everyone, every participant as well as the organizer for this good opportunity. So here I'm going to present the recent work which we have published as a book. So here I'm going to demonstrate some outcome from the book. The detailed code and all, if you are interested in working in this particular domain, Okay, I will share it after Wednesday, either on Wednesday or after Wednesday. I will share it through Dr. Ram sir. So this is our recent work. This work was done along with my research mentor, Dr. Nilanjan De sir. I hope I also one of the speaker in this FDP. So is having a lot of publication. This is one of the publication. This is our recent upcoming work, which is related to magnetic resonance imaging. So here I'm going to present some major sections which we have used in this particular book. Okay, particular then in this session. Okay, in this session I'm going to consider only the brain imaging, brain MRA. Okay, then if you are interested along with the brain MRA, then I can share other MRIs like breast MRI and heart MRI, etc., which you can practice. Okay, the code which we use for brain MRA can be used for other MRI also. Okay, it's just MRI. It's a medical modality, imaging modality, which records the image in the form of 3D. So either we can evaluate the recorded image in 3D or 2D form. Okay, 3D form requires more computation effort. That is, the RAM size must be more, and we need more value of graphical processor, etc. That's why the commonly adopted procedure is first we'll convert the existing 3D image into 2D slice. So when we convert an existing 3D image into 2D slice, here we will get different planes such as top view, side view, and front view. So according to our need, yeah, we can use any one of the plane, or we can use all the planes to evaluate the disease. Okay, today's the presentation is organized as follows. First, we are going to see what is the need of medical imaging in hospitals, particularly when analyzing disease in internal body sections. Then we are going to see what are the other imaging methods which is existing in hospitals and its merits and demerits. Then from that, why MRI is widely preferred, then other images, etc. we will see in initially. Okay. So here, if we take the magnetic resonance imaging, that is one of the proven and widely adopted radiological procedure in hospitals, particularly to record the disease in internal organs. Okay, particularly if we have some disease in brain, okay, the brain disease can be evaluated with the help of some ECG signal, which can be collected using some scalp electrodes, either a single electrode or multiple electrode. So with the help of that ECG, not ECG, EEG signal, electroencephalogram. So EEG, with the help of EEG, we can get some information, some basic information about the brain, whether its condition is good or it's having some disease and all. Particularly if we want to analyze the disease, its severity and its location in a brain, then compulsorily we should go with some image assisted diagnosis compared to the signal based approach. Okay, that is the major advantage of medical imaging scheme. Okay, that will help us to get the information such as the disease, its severity, and its location. Say, for example, say in a brain, if we have some tumor or some other infection, okay, we can get a clear picture about the infection. Okay, the location, its severity, etc., can be easily identified when we use medical image compared to medical signals. Then next in our presentation, we are going to see 1 minute. In our presentation, we are going to see the conversion procedure. Okay, in these are open source softwares. Okay, it's readily accessible for research purpose. Commercial purpose, I think it's restricted. For research purpose, we can use this procedure in order to convert an existing three-dimensional image. It may be any medical image into 2D image. We can do it with some open source software. Okay, we'll discuss one by one. Okay, the next, if we consider the MRI, actually it is in RGB form. That is the pixels. Okay, the combination of pixel will be giving some image. Okay, normally if we consider MRI, even though it looks like a grayscale image, okay, if we can do some in-depth analysis with some dedicated softwares, we can found it's a combination of red, green, and blue pixels. Okay, so normally an MRI will be in the form of RGB scale, but for evaluation, it looks like a grayscale image. For evaluation, if we consider RGB image as it is, okay, because of its 3-pixel group, the complexity will be more. Okay, so we can analyze R pixel alone, or green pixel alone, or blue pixel alone, but that will not provide sufficient information if we are particularly interested in evaluating the disease. That's why in MRI analysis, okay, after converting a 3D image into 2D image or 2D slice, okay, it is necessary to implement RGB to gray conversion, okay, without degrading the quality of the image. Okay, so without degrading the quality, the color image, actually it's a color image, but it will look like grayscale image. Even though we convert the color image into grayscale, the visibility will not change. Okay, that is one advantage in MRI. Then after that, but nowadays everyone is using some MRI which is having some improved softwares, which the softwares can be used to monitor the entire operation of the MRI from the signal generation to image reconstruction. Okay, in recent years, there is we can get a clear picture from the MRI machine, okay, without any deviation. But for research purpose, say we have some MRI which is having some unwanted defects, like the MRI corrected with noise, the MRI is a blurred MRI with a blurred image, etc., can be corrected before it is to be analyzed manually, or it is to be analyzed using some computer software. Okay, so these things we will discuss during MRI enhancement approach. Okay, under this title, we will come to see the various methods. Okay, here we presented only a few methods. We have a lot of approaches. Okay, so I will share that personally. You can use if you are interested. Okay, so here MRI enhancement methods, but we have to remember one thing, that currently in every hospital, so mostly it will be if they are having that MRI machine, say it may be a good that is a multi-specialty hospital or a dedicated scan center. Okay, in order to have a better image, okay, they will do a lot of investment uh, by which helps them to replace the old MRI machine, or they replace the old computer software which help to control the entire operation, that entire imaging operation. Then we can assure that, okay, if for the patient condition and other things are perfect, then the machine can provide some image without any defect. That is a blurred image, image with noise, and all nowadays very less. Okay, we cannot find these things during practical MRI examination, but for research purpose, we have to consider these things. That is, if we get some MRI from some image, or for some from some patient, if it is having some defect, instead of going for another one MRI scan, we must able to fix the image ourselves using some computer algorithm. Okay, these things will be discussed in a MRI enhancement scheme. The next, what are the basic abnormalities which can be identified with MRI? We'll discuss here. Then what are the procedures that can be implemented to extract the abnormality from the MRI image, then what are the methods which can be adapted to examine or to analyze the extracted abnormality. Okay, these things we can discuss at this title. Then after that, we will discuss what is meant by segmentation and what is the need of various segmentation procedures, both automated as well as semi-automated. Then, if it is a machine learning technique, what are the things to be considered? Okay, when we consider MRI image. Then, if it is deep learning, what are the other things to be adapted? Okay, then our conclusion of this session. So here my kind requesters. So if you have any doubt, so here parallelly I will demonstrate some MATLAB codes. Okay, whenever you have some doubt, immediately you ask me so that I can help you to correct my mistake, or I may help you to understand the particular topic. Okay, thank you very much. So I request you to confirm. Can you hear my voice clearly? Some of you kindly confirm.
You are clearly
Ah,
audible.
yes,
You are
yes, sir.
clearly audible.
Yeah, thank you, sir. Thank you very much. Yes. So first, let us discuss about the disease diagnosis. Okay. So in recent years, okay, we have a lot of facilities to predict the disease in its early phase. Okay, because we know that whatever may be the disease, okay, it will show some symptoms. Okay, whatever may be the disease, okay, it will show some early symptoms. When we get some early symptoms, then we have to approach some doctor for some initial assessment. If the doctor feels during the initial assessment, if he cannot get the clear idea about the disease, then he will suggest for some scanning. Okay, normally directly they will not they will not suggest for radiological scanning. Say initially they are suggesting for some blood level analysis. When we do some blood level analysis, if we saw our blood count, that is white blood cell count is very high compared to the normal one, then that represents some indication of some infectious disease or some other acute disease which is existing in our body. Then after analyzing the blood count value, that is particularly leukocyte value, okay, after some blood test, the doctor will evaluate all the reports. Then if he gets some doubt regarding some other disease in our internal body section, then he will suggest for some additional diagnosis. Okay, so MRI or CT, both are some additional diagnosis which can be used to evaluate the disease which is inside the body organ. So if we take CT, the CT will have its own limitation. The first one is, okay, it requires some contrast agent, high level contrast agent, that is to be injected in our body part in order to have a clear as well as bright picture. That is the one requirement in CT. The next, if we consider CT, that is computer tomography based image, its visibility is always lesser compared to MRI. Because if we have MRI, we have a lot of sub classes. Okay, according to the need, according to the requirement, we can choose the required subclass. But in CT, we don't have that procedure, that advantage. So if it is a CT, this also gives a 3D image, okay, which can be evaluated in terms of 2D slices. Similarly, if we take MRI, that also gives 3D image, okay, reconstructed 3D image. But compared to the computer tomography, magnetic resonance imaging will have its own merits. Okay, hence in most of the disease evaluation cases, particularly when we consider internal body organs such as kidney, liver, or gastric tract, or lungs. Sorry, not lungs also we can do, but for lungs they prefer only CT because lungs are um, having some other complex structure that can be easily done by CT. The usage of MRI for lung is very limited. Then along with the gastric tract and breast imaging can be done with MRI, heart imaging can be done MRI. Then particularly MRI is most suited to scan the brain when we have to evaluate some abnormality. We can also use CT to scan the brain abnormality, but compared to MRI, the image quality which we obtain in CT is very less. That's why whenever we have to detect or whenever we have to analyze the disease in brain, it may be any disease ranging from tumor to some stroke, whatever may be the disease. If we want to analyze the disease, then MRI is one of the prime choice compared to other modalities. The next, the main advantage of this medical imaging is we can get a recorded image which can be easily understood by anyone. Even um, it will not be under, you say we are not having any much information about the particular disease. If we can see some MRI image, there we can see some change in intensity of the image, that there will be some change in pixel of the image, pixel group or pixel level of the image. That itself will let us know uh, this part is having some defect compared to other parts. Okay, that is the advantage of medical imaging, which gives a clear information about the disease which is to be evaluated compared to the other approaches followed in hospitals. Then another one merit of the medical imaging based disease diagnosis includes quick and accurate disease detection. That is, after seeing that image itself, we can easily classify this section is infected with some disease and this section is free from this disease. Like that, we can make some initial decision. Then, if we can detect the disease appropriately or accurately, then the doctor can immediately make the decision and he can start the treatment. The treatment may be a small medication or the treatment may be surgery, whatever it may be. Okay. So when we have some accurate medical imaging, it will support the doctor in making the right decision and appropriate treatment implementation. Okay. Further, the medical images which obtained from various patients can be used to create the disease model. When the disease model is available with the hospital, then whatever the new information comes, say for example, say one patient is recorded with some other disease, then that recorded image can be compared against the model. Then the model help you to help the doctor to get the appropriate uh, infection level as well as the appropriate treatment, etc. That is, in some cases, the developed model can be used to get the disease information and medication facilities. Okay, these are the advantage of the medical imaging compared to the signals. Then another one advantage of medical imaging approaches, we can record the images without touching the organs. Okay, without touching the organs, it is possible for us to record the image. Okay, so for example, if we take thermal imaging or something else, so from the body some radiation will come. If we can have thermal camera somewhere else, it will capture the body radiation, and there will be some software. The software will convert the IR radiation which is coming out from the body into some image. Okay, RGB scaled image. Okay, this kind of things are called as non-invasive approaches. Non-invasive means without touching the body part physically, we can record the or we can get the information about the disease or the organ's activity. Okay, these are some merits of biomedical images. Okay, so if we consider biomedical imaging approach, the choice of a particular disease, the choice of a particular imaging scheme depends on the disease. First thing is the disease. Second one is its a location in which organ it was the disease is existing. Third, the patient's condition. So, for example, say the patient was very sick, he is very allergic to some radiation, some uh, um, some other radiation like CT radiation or MRI radiation, then we cannot suggest MRI or CT for that particular patient. Then we can go with some other methodology, okay, which causes a lesser harmness. Okay, so then next, if some patient is having some allergic reaction, if he is injected with some contrast agent during CT or MRI, that may also increase increase the sickness of the patient. So before recommending some appropriate or the required disease detection methodology, it is the responsibility of the doctor to choose right imaging procedure to diagnose the patient. Okay, so if we take the hospitals, okay, they are having a lot of imaging modalities or methodologies. So the first one, the recent one is thermal imaging. Okay, thermal imaging widely used to capture the skin level radiations to identify the disease. Okay, the disease which is closely related with um, the body exterior. For example, say fever or some other infectious disease, because fever is there, then the body temperature will be more. Then if we can capture the temperature of the body, then they will have some thermal scales. According to the captured image, they will compare the image color with the existing thermal scale. Then they will predict the nature of the disease. Okay, thermal imaging nowadays it is widely used to identify the fever-like symptoms, then breast cancer, then diabetes, etc. Okay, I will share the information later. When I share the necessary code, along with that code, I will share some basic thermal imaging. Then ultrasound is one of the oldest imaging modality, which is widely used to record the sensitive organs of the body using some sound waves. Okay, there will be a wand-like setup that will be having both the transmitter as well as receiver. Through the transmitter, a sound wave, high frequency sound wave will be transmitted. When the sound wave hits the organ, it will be reflected back towards the receiver. Then the wand is that is the ultrasound transmitter as well as receiver is connected with some computer software. The software will reconstruct some approximate image by evaluating the transmitted as well as reflected sound wave. Okay, the ultrasound in recent years, the ultrasound is widely adapted to study the growth rate of a child. Then it can also be used to study the breast cancer. Okay, so to evaluate the breast cancer, we can use ultrasound, because ultrasound guided needle biopsy is widely adapted when we evaluate the breast cancer. Okay, this is beyond our scope. Okay, if you need, I will let you know the data set location for ultrasound fetus head circumference image. Then I also give you the link for breast cancer image with ultrasound. You can use it for your research if you're interested. The next histopathology images. In this, it's related to the blood samples. Okay, histopathology images are widely adapted to evaluate blood level infection or infectious disease screening. Okay, during this histopathology evaluation, first they will collect uh, recommended amount of blood from the infected person. Then with the help of the blood, they will create some slides. Then every slide will be added with some contrast agent in order to separate the normal section with abnormal section. Then the contrast enhanced image will be evaluated with the help of microscope. Okay, the microscope analysis can be used to detect the value of blood count, the number of white blood cell, and infections such as malaria. Okay, thus histopathology also used to diagnose the cancer and its stage. Okay, so this image location also I may give later. Okay, through Dr. Ramsar, you can access the image if you are interested. Then radiographs, it is one of the oldest methodology, okay, which records the internal body parts which is to be examined, okay, using some X-rays based approach. In olden days, they used physical film like methodology to record the image. Nowadays, they're having software based recording. So the main drawback of X-ray is the visibility of the infected section in X-ray is very less compared to the modalities like a CT and MRI. But cost-wise, cost as well as the implementation of X-ray is cheap compared to the CT as well as MRI. Similarly, the side effect due to the radiation in X-ray is lesser than CT as well as MRI. Okay, we normally we can use X-ray to scan the breast cancer. That's called a mammogram. Then we can, if we want to analyze some lung infection, then we can go with X-ray. Okay. Then similarly, bone level infection can be done by X-ray. So where we cannot use CT as well as MRI. So computed tomography is another one major imaging scheme normally used to evaluate. In olden days, they used CT to record brain and its abnormality. Okay, but compared to the CT, MRI is widely used because of its merit. Nowadays, the CT are used widely to evaluate lung and its related sections. Okay, if we want to analyze lung activity of lung or infection in lung, etc., that can be done with the help of CT. Okay, then MRI. MRI is one of the well-known imaging scheme which is widely used to examine various body sections. Okay, so main merit of the MRI compared to other approaches are the clarity is good, that is image quality is good compared to the CT. Multiple modality means we can have around five different classes, not five, 6+ different classes of MRIs, okay, according to the need, that is according to the visibility of the abnormal as well as normal section, we can choose the required modality. We'll discuss one by one. Then it gives a reconstructed 3D image. We can get a reconstructed 3D image in CT also, but these methods, okay, thermal imaging, ultrasound, histopathology, etc., may not provide a 3D image. Okay, so main merit of the MRI is clarity is good, multiple modality, it provides 3D image compared to other methods. The next, when the patient is recommended for MRI scan by the doctor. Particularly, the MRI scan must be recommended for very harsh diseases. Okay, particularly if we consider if a patient is having some symptom for cancer, then we can suggest MRI. Or the patient's condition is very ill. For example, say he's having a very worst heart disease or very worst brain disease, then we can suggest MRI. Okay, so when MRI is suggested, the patient having the radiologist will discuss with the doctor. Okay, then according to the patient's condition, the radiologist will decide the contrast agent which is to be injected inside the patient during the imaging. Okay, when we don't have any contrast agent in patient body, then we can capture the image using the MRI, that radiological procedure. Then the visibility of the infected section is similar to normal section. Okay, we don't find any pixel difference or contrast difference between the normal image part, normal section, as well as abnormal section in that image. To avoid that, what they will do is initially they will inject a contrast agent called gadolinium. Okay, when the contrast agent is injected into the patient, okay, after some time, after some minutes, the contrast agent will be accumulated in the location where infection is more. Okay, so the contrast agent will leave the normal section and it will try to accumulate in the location where the infection is more. Then if we capture the image of that particular section along with the contrast agent, then we can get a clear image of the infected region compared to other section. That is the major advantage of contrast agent. But if we take the contrast agent, that will cause a temporary to permanent allergy to the patient. Okay, sometimes due to this allergy, the patient may develop some other disease. Okay, that is the major drawback of the contrast agent. But if it is necessary, without contrast agent, say if we cannot do the particular diagnosis, then it must be used. But we can reduce the radiologist may reduce the dosage level of the contrast agent after discussing with the doctor, because the doctor only give the patient information to the radiologist. The radiologist will analyze the patient information according to the doctor's suggestion as well as patient's health condition. The radiologist will decide the dosage level of the contrast agent which is to be injected into the patient's body. Okay, so if the contrast agent level is more, that may develop some other disease in future. Okay, then during this MRI examination, the patients are not allowed to have any metal ornaments or metal parts with him. Then after recording the MRI with a chosen modality, then it will be evaluated by the doctor personally. First, the radiologist will read the MRI, reconstructed MRI himself, and I will generate some report. After generating the sufficient report, the report along with the image will be transferred to the doctor. Either the doctor can evaluate the recorded image himself personally, or he can evaluate it with the help of some computer software. This is the procedure which is normally followed in hospital. So according to the MRI, okay, so from here, the slide onwards, we will concentrate more on MRI, then the basic things. Say one patient is admitted in some hospital and the doctor suggests some radiological evaluation. to identify the disease and its harshness. Okay, when the patient is admitted for some MRI scanning, okay, according to the doctor's suggestion, the patient may be diagnosed with contrast agent or without contrast agent. Without contrast agent means we can assume that the infection or the disease level of the patient is less, then the doctor needs this kind of MRI only for the confirmation. Okay, so when the doctor is having some idea about the disease which is existing in the patient, and if you want to clarify or confirm the disease further, then he can suggest a non-contrast based MRI. In non-contrast based MRI, the visibility of the abnormal section or infected section will be very less. When the doctor say the patient is confirmed with some disease, the doctor want a clear picture about the disease, that is its harshness, then its location, etc., to plan for some further treatment. Then the doctor will suggest contrast supported MRI scanning. Contrast supported MRI scanning means the doctor will suggest, the doctor will request the radiologist to record the MRI after injecting some contrast agent into the patient's body. Okay, so if we consider this, then it is clear that MRI can be recorded with the contrast agent or without contrast agent, which will be decided by the doctor as well as the radiologist. Okay, so we cannot give any suggestion to them. So the type of MRI will be decided by the doctor as well as radiologist. The next, if we consider MRI according to the image or according to the section which we want to record, it is further having various classes. Okay, either we can choose a particular class or allow any combination of the class in order to have a better diagnosis. The first, which gives the best visibility of the normal as well as abnormal section, is flare modality. Okay, fluid attenuated inversion recovery. It's one of the widely recommended MRI approach, which provides a very clear image of the body section which is to be examined. So flare is one of the widely adopted imaging technique. Okay, then second one is T2 modality. Okay, T2 image, T2 MRI. This also gives a very clear picture of the disease which is recorded. But in T2, along with the disease, it also gives a clear image of the empty or air captured section. Okay, so for example, say we have some tumor somewhere else, say already the contrast agent was inserted into the patient, then the tumor section will be more visible. Along with the tumor section, the empty section, because if we take the body tissues, it will not have a cluster like setup. Okay, say it's like a chamber, first chamber, second chamber. In between chamber, there will be some opening. Then the opening section also will look very bright in T2 modality image. The next, if we want to evaluate something approximately, then we can go with T1 modality. In T1 modality, the visibility of the abnormal section is very less. Further, if you want to increase the visibility of T1 modality, then we can go with another one approach called T1C, that is T1 modality, which captures only the contrast enhanced section. Okay, then that is called a T1C. The next approach is diffusion weight, then stir fMRI, fMRI. Okay, these are some, this fMRI is one of the recent technique, recent and advanced MRI technique. In MRA, along with the disease infected section, they also record the vessels, okay, blood vessels or some vessel like setup in the organ. Okay, the MRI and the MRA are closely related to each other. Okay, in angiogram, they will try to record the blood vessel along with the infected section. Okay, these are some modalities. The choice of the modality will be done by the doctor as well as radiologist. Either they will stop with flare alone, or they may use flare along with the T2. In some cases, they can combine a flare with some other approach. Okay, at the end of the day, the aim is getting clear picture of the disease infected region. For example, say if we have a brain, say the brain is infected with some disease, say tumor, then we should have a clear picture of the tumor in brain, like infection, its swelling rate, its orientation in brain, and how far it is located from the skull section. If it is nearer to the skull, if its size is less, then they can remove it using keyhole surgery. They will put a hole, simply they will do a minor surgery and they will remove the tumor. If the tumor size is more, then they can suggest open skull surgery. Okay, these things. Okay, in order to plan these kind of things, it is necessary to have a clear picture about the disease. So in order to get a clear picture of the disease, the radiologist as well as the doctor will discuss themselves, and based on their own discussion as well as the patient's condition, they will fix the type of modality and a type of imaging. Either it may be contrast or non-contrast based, or it may be any one or few of the modality. Okay, it's not necessary to have all this modality at a it's not necessary to record the patient with all these modality. Either they may go with only with the flare or T2 alone or DW, like that. Okay, the choice of the particular modality depends on the doctor as well as radiologist. The next, let us have some discussion on how the MRI can be evaluated using some computer algorithm. Okay, so here we are going to discuss everything in an engineer's point of view. Say we keep the doctor away now. Say here, assume we have obtained some 3D structure of the MRI from some scan center or from some database location. Say we have some 3D image with us. The 3D image must be evaluated using some software in order to support automated disease detection or automated disease classification. Okay, so now we have a 3D image with us. So main drawback in 3D images, it's volume. Volume means the capacity of the image is very high. So if we want to evaluate a 3D image as it is, we need a very high computational facility. That is, I need sufficient RAM. Say I need a RAM which is more than 8 GB or 16 GB or 12 GB, etc. Then I need graphical RAM. That is, I need a sufficient GPU, say 4 GB or 2 GB graphic card I need in order to open as well as evaluate the three-dimensional image. The next, in order to have a clear view of the 3D image, we need dedicated softwares. Okay, so we need specialized softwares, we need necessary GPU, we need necessary RAM in order to evaluate a 3D image as 3D. Okay, we have a 3D image. It is to be evaluated in 3D form. Then if we want to evaluate a 3D image in 3D form, then we need a lot of things to be done. To overcome that, say here we have some conventional software or a conventional system with us. With the help of a conventional system, if we want to do some analysis with the 3D image, first we should convert the existing 3D image into 2D image. That is the first procedure. Okay, for example, say if we want to evaluate a brain MRI, okay, whenever we get the MRI from some scan center or some hospital, it will be in DICOM form. Okay, DICOM, a 3D image format. We need to extract the 2D slices using some dedicated or specialized softwares. So if we take a 3D to 2D conversion, that is our first procedure when we are interested in doing some research with MRI. So here in literature, we have a lot of softwares which can help us to convert a three-dimensional image into two-dimensional image. Either it may be a basic MATLAB software or Python, whatever it may be. The main aim is we have to convert a three-dimensional image into three numbers of 2D slices. The first is the top view, second is the front view, third is the side view. Okay. The next, the conversion of 3D. For example, say here we have an apple. If we take the apple as it is, that is in the form of 3D. Then if we are converting the apple into 2D, then we have to make the apple into slices. Okay. Here our apple will be having more combination of more number of slices will be a 3D apple. Then here the number of slices which can we fix we can fix according to the thickness we assign, slice thickness we assign during the MRI scan. Okay, so during the MRI scan, it is necessary to fix the slice thickness. So after scanning, actually the MRI produces reconstructed 3D image. The MRI will not give image in the form of 3D. It will takes all the slices from the MRI machine. Then with the help of some computer software, what they will do is they will merge all the 2D slices in order to get a 3D image. That's why it's called as a reconstructed MRI image. Okay, during the image capturing, it sends 2D image. Then there will be some computer algorithm which is associated with the MRI machine, which gets us the 3D image. Okay, so here we can fix the slice thickness based on the number of based on the slice thickness, the number of slices will be decided for a particular 3D image. Okay, so normally whatever software we use, a 3D image, a three-dimensional conventional image can be converted into three different 2D slices. Okay, three different 2D slices. The first thing is called as axial plane. Second is coronal plane. Third is sagittal plane. Okay, this sagittal will be the side view. Okay, coronal will be the back side view, and axial will be the top view. Okay, so if we use a particular software, okay, which converts a complex 3D image into simple 2D image of our own choice. Okay, say for example, say the image dimension is something, then the dimension can be increased or decreased according to our need. Okay, but we don't have sufficient facility to increase or decrease the dimension of 3D image. That is the only drawback. We can make it, we can adjust the dimension of 3D image, but we need higher system version. Second, we need dedicated software. So if we take 3D to 2D conversion, The commonly used for research purpose, the commonly used software is called ITK Snap. Okay, ITK Snap is one of the software, one of the leading open source software, which was developed by this researchers. Okay, this software can be obtained from this location. You can download this software. Okay, it's a open source. You can download this software. Okay, with the help of the software, you can open any 3D image. Okay, if you open any 3D image using that particular software, that will give you 2D slices like axial, sagittal, coronal slice. It will show where you can. I will show everything with during demo, where you can have a choice to choose the required slice. Okay, for example, say if we have an apple, if we want to identify the seed in the apple, it will be available only at the center. So if we do slices from one edge to another edge, okay, continuously, if we chop the apple with a fixed slice, we can find the seeds only at the center slice. Similarly, okay, in brain, if we have some tumor or abnormality, okay, if say it is in 3D form, okay, say the 3D image is converted into 100 number of 2D slices. In 100 number of 2D slices, we don't have the tumor. In some particular slice only, we can find the tumor and its traces. Okay, then we have to choose only the particular slice for examination. Then we can ignore other slices, other 2D slices. Okay, so if we use ITK Snap, we have the choice to select a particular slice for examination. Normally, the slice can be stored in three different image file formats like .png, .jpg, and a .tiff. Okay, so I will explain during the demo. I will explain everything. So if you want to, yeah, this is the first line is the actual website location. Okay, this is the website location. Here we can download the software. Here they have developed, they have given two versions of software. One is for Windows user, second is for Mac user. Okay, for Windows user, they have given software versions also 32-bit and 64-bit. According to your need, you can choose any software. Similarly, they have given one brain MRI dataset for initial training. You can download the dataset. It is in 3D form. You can do your own analysis with the software. Then you can also, please listen, you can also do some manual segmentation. Say you can find tumor there. The software supports manually segmenting. Segmenting means with the help of the software, manually you can extract the particular infected section from the image which was opened using ITK software. Okay, ITK Snap is a unique software which works like 3D to 2D conversion. The first one, second is level set segmentation, ground truth creation, then image visualization. It can be used for any purpose. Okay, according to our need, we can use the software for any task. But in our work, in my earlier work, we considered the software only to convert 3D image into 2D slice. That's all. We used only for this. In some cases, we used the software to develop ground truth images. Whenever we use the software, we must acknowledge or we must include this research work in our reference. Then this is the software output. So here we have considered a 3D image of well-known brain stroke data set that is called ISLES. ISLES is the isometric stroke lesion data set, which was uh, developed and donated for that is it's a open source software developed in 2015. Okay, this software, this data set can be used to do any research work which is related to MRI. This is a data set without the skull section. Then if we take a general brain data set, it is available with the skull section. Okay, this is the skull. Okay, if we want to do some manual analysis, okay, if we want to do some manual analysis, then during the time, we can keep the skull. Say we want to implement a semi-automated segmentation, that is manually I'm interested in extracting the tumor section. Say this is the tumor abnormal section. Then if I want to extract this manually, then I can keep this skull, because manually I'm going to do some marking, then I'm going to cut and I'm going to extract it for some further evaluation. So during that condition, we can keep the cull section as it is. But if we want to do some automatic segmentation, then the cull section from the brain MRI, particularly if we are using brain, then it is associated with skull. But if we are analyzing the heart MRI or breast MRI, etc., we don't have any this kind of issues. Directly we can implement our software. Okay, so whenever we have the skull, then we have to use separate procedure which can help us to extract or remove the skull section from the brain section which is to be examined. So if we take this section, and now I will show the demo. So this section can be known as, this section can be called as axial. Okay, here you can see a cursor like setup. Okay, you can move it, you can move this up and down, so that here you can adjust your slice. I hope it is visible to you. Here we have totally 155 slices. Okay, total number of slices in this particular MRI is 155. This image is 73rd. Okay, 73rd slice. Similarly, if you take this is axial, this is sagittal view, side view, this is the back side view. Okay, so now let me show some demo with this software. 1 minute. 1 minute, participants. Please permit me to open and explain this with ITK Snap. Then after that, I will continue the slides. 1 minute. One minute, sir. Yeah. Okay, some of you please confirm. Can you see this software now? Some of you please kindly confirm this. Can you see this software?
Yes, sir.
Yeah, thank you very much. Now this is the ITK Snap. Here we are going to open some 3D image, say particularly brain or breast image, whatever it may be. I will open both the images. Okay, then after that I will help you how it can be stored or it can be extracted, how we can extract a 2D section, and how we can store it in some folder. Okay, let me explain it now. So first what we have to do is in left hand side topmost, there you can see a thing is called otherwise you will learn. I will let you know the software through the, after that I will share the information with Dr. Ram sir. He will share the details with you. So first what we have to do is we have to open the particular image. So here if we take 1 minute, sir. So here, say here, I have a Brad's data set. This is one of the widely used. Here you can see, I think it's, yes. Say here I am considering flare image data set. Can you see it now? Here, if we drag this cursor, here you can see that, otherwise, let me open another one image. One minute. Because here the visibility is less, that's why I'm selecting this image. Yes. Now I think you can see it. Here, if this cursor, if you are opening, okay, you can see in axial, the image orientation changes. Okay, totally this image has 155 slices, total slices. The 3D is sliced into 155 2D images. Say this is our first slice. So if we are keep on increasing the slice, just you watch the left hand side alone. Okay, up to this slice number, you can check it is 40 plus. Up to this we can yeah. So this is the location of the tumor. This is the location of the tumor. Up to slice 45, tumor visibility is less. Then we are keep on increasing the slices. Then the tumor visibility will gradually increase. So now if you take this image slice, here we can find more visibility in tumor. Okay, so if we take this image, if we take this section, this part, then it is called axial. Then if you take this part, this this image, now something is moving. No, if we take that part, that is called sagittal plane. That is the side view. So if you take this changing thing, this is called a coronal. So for example, say we want to save a particular image. Say this particular slice must be saved. Then in file, there will be an option called export. Okay, in file, there is an option called export. In export, if you go to image slice, here we can see three different slices: axial, coronal, and sagittal. Say for example, say if we are interested in axial, then we can choose axial image. Then we can choose the location where we want to save it. Okay. Then after that, here we have the option .png, .tiff, and .jpg. Okay. So whatever version or whatever image method which we need, we can choose. Then after that, if we save it, then the particular slice alone, not the whole 3D, the particular slice, okay, which we can see now. For example, say if I see whatever image which we can see now will be saved separately. Axial, if I'm interested only in axial, then I can move all the axial slices, then I can save it. Okay, same thing is applicable for coronal and sagittal. But research point of view, we are very much interested in axial images, then coronal as well as sagittal. So if you take this particular MRI, it is free from the skull section. So we don't need to have any other software which extract the skull. But if we choose some other image, 1 minute, sir. If we choose some other image, which is associated with skull section, then we must use a procedure called skull stripping. Yes, here you can see this is the image with the skull. So here our aim is we have to extract only this infected region. Okay, if we want to extract this infected region manually, this section, okay, this section manually, then no need to remove the skull section. This is the skull. No need to remove the skull. If manually we want to extract this particular section, the skull can be retained as it is. Okay. If we want to do some automatic extraction, then initially the skull must be removed. After removing the skull from all the test image once again must be evaluated with the recommended software. So in ITK Snap, we have all the facility. Manually also we can extract this section. If we want to extract this manually, okay, then we have tools which will extract us. Okay, here we have tools. With the help of that particular tool, we can extract this section. Okay, this is the advantage of ITK Snap compared to other open source software. It supports 3D to 2D conversion, manual extraction, then ground truth generation, and some other assessment according to the need. But as of now, we are using in our earlier research up to our last work, we used this thing only for tumor extraction. Sorry, not tumor extraction, 3D to 2D conversion. Okay. If you permit, then I can start my presentation from our earlier session. Shall I proceed?
Yes, sir.
Yeah, thank you, sir. So I share all the information with Dr. Ram, sir. Okay, you can have the PPT so that you can easily learn. So this is the first step. After collecting the image, the first step is converting a 3D slice into 2D slice. Sorry, 3D image into 2D slice. For 2D slice, we are going to decide either we are going to use axial or coronal or sagittal. So it's only if it is only research purpose, then we can fix with axial plane. Okay, not only we are not going to evaluate only one slice, we are extracting all the possible slice. Say here was totally we have 155 slice with, but in 155 slice, say only 40 slices are having tumors, then we are going to extract only that 40 slice. Then after that, we are going to use the 40 slice to for our analysis. Then we will develop some software tool which can extract the tumor automatically. The next, say here our aim is only extracting the tumor from the image. That is only extracting the abnormal region from the image. Say that is the only task which we have. So if we have the task like extracting only the abnormal section from the image, then it is our duty to reduce the complexity further. Because if we take this image 2D slice which was extracted from a 3D image, if we plot the histogram is nothing but a pixel distribution in the image. Okay, distribution of pixel with respect to the threshold. Normally, for simplicity, we are having images whose maximum threshold is 256. Threshold is different, image dimension is different. Okay, here threshold level of the images say 256. That is the maximum thing which we find in most of the image cases. But if you go with microscopic images, I have done one work with microscopic images that had some threshold level more than 3000 plus. Then I have reduced its complexity by converting using some MATLAB code. I have reduced its threshold level from higher value to 256 without degrading the quality of the image. Okay, it's applicable for fluorescent microscope image. That is different. So here for normal MRI case, whenever we extract the MRI, before evaluating the MRI, it is our duty to verify whether it is in grayscale or it is in RGB scale or in grayscale. If you take this particular MRI, which we extracted now using ITK snap, if we plot the histogram of the image using the particular code, then even though it looks like it has a single histogram pixel distribution, if we plot this, then it can show it is the combination. So RGB scale image means we'll be having 3 different pixel distributions. Say this is your blue pixel. The next we have same RGB. You can view, if you use this particular code for some RGB scale image, then it will get you the distribution of pixels like R pixel, green pixel, and blue pixel for the image. So if we take this particular image, this is an RGB. If we use RGB image to extract only this particular section, that is the tumor section, then it may take more time because the computer software will analyze R pixel separately, green pixel separately, blue pixel separately. After analyzing these pixels, it will try to identify the tumor. Then it will extract the tumor and it will provide the tumor for us for further analysis. But our only aim here is not analyzing R pixel, G and B pixels. Your aim is extracting the tumor. That's why what we are going to do initially is we are going to convert the color image. Even though it looks like a grayscale image, actually its pixels are combination of colors, RGB. So here what we are going to do is we are going to reduce the complexity of the image by simply converting this color image into grayscale image. So this is the converted grayscale image. If you look this two image with our eye, both look similar. The RGB image and the grayscale image both look similar if we see it in our eye. But if we see the image with some MATLAB code, this image before conversion, this image will give a pixel distribution it will give a complex pixel distribution. Then if you take grayscale image, that will give a small minimal pixel distribution. Minimal means it will be having a single pixel group. Okay, the pixel group value may be dark pixel, light pixel, or gray pixel. Gray is nothing but a combination of dark and light. Okay, so if we want to evaluate MRI, okay, if we want to evaluate the MRI, it's our duty to convert the RGB image into gray image before the analysis. Because if we can achieve RGB to gray conversion, then we are reducing the complexity of the image which is to be examined. So if you take the particular code, this is the code which we can consider to convert and to get RGB scaled histogram from the image. Okay, from the RGB image, if we want to plot the RGB scale threshold, then we can use this code. Similarly, if we are interested in converting the RGB image into grayscale image and to plot the code, then we can use a command called RGB to gray in MATLAB. Okay, then after the conversion, if we want to analyze its pixel distribution, then we can simply use the command called imhist. Imhist is nothing but plot the histogram code. Okay, that is the major point which is to be considered while we consider the MRI examination. Okay, the next basic MRI enhancement schemes. Okay, so if we take the basic MRI image, okay, say we had a 3D image, we have converted the 3D image into 2D image. Okay, after the conversion, say we have converted the 2D image into gray. Now say we have a grayscale image with us. Then what are the additional procedures that must be implemented for the particular slice in order to increase the automated evaluation? Okay, so say from MRI scan, we got 3D image. Then with the help of some other software, say we have converted 3D into 2D slices. Okay, then after that, say we converted color to gray and we have resized the image into some particular size. So resizing plays a major task when we evaluate, when we implement a computer software to examine some medical images. A tiny image, a tiny image takes lesser time, then a big image may take larger time because of its pixels. Okay, so if the image size is less, the number of pixels which is to be examined will be very less. If image size, same image, we can enlarge it like our photograph. Okay, passport size, enlarged size. According to that, the number of pixels will increase. When pixels increases, its evaluation time also will increase. So for automated analysis, a recommended size may be 256 cross 256. That is, height and width must be 256. Okay, it varies. For machine learning or automated or semi-automated approach, I request you to stick with 256 cross 256 size. Okay, either it may be a grayscale. Grayscale means it may be like this. Okay, cross 1. Cross 1 means grayscale. Into 3, it will be RGB. So 256 cross 256 will get us the good result when we do it automatically or manually. Similarly, if we go with some particular deep learning schemes, if it is AlexNet, the size of image must be 227 cross 227. Either it may be into 1 or into 3. That is grayscale or RGB scale. Other than AlexNet, it must be 224 cross 224. Okay, if you're doing some analysis using machine learning approach or some other approach, you stick with 256 to get the result within lesser time. Similarly, if we are going with a deep learning technique, then let us choose the size like 227 in case of AlexNet, 224 in case of other approaches. Okay. The next, if we consider the particular topic, MRI enhancement. Okay, directly say we have obtained some MRI from hospital. We have converted the MRI, 3D MRI into 2D MRI. Then we have converted RGB into gray. Then we directly given it to some software. It will not give output in most of the cases because the software requires some pre-processing. Image pre-processing means the available 2D image must be converted into some other image before it is to be evaluated with the software. That is, we need some image enhancement. Image enhancement means here the given image, some image we are giving, that image must be improved. Improved means we are not going to improve the whole image. Here our only aim is abnormality which is existing in the image. That is our prime work, prime task. So in order to improve the abnormality, what we are going to do is we are going to apply some image pre-processing method, which will enhance the abnormality by degrading the normal section. Normal section will be degraded, abnormal section will be enhanced before it is to be evaluated with the software. Okay. This approach includes the contrast improvement. We have a lot of procedures. Okay, if you need, I will share you the code later. Okay, let me go to the next topic. Okay, so here the first image enhancement. So just now we discussed. So if we take the particular MRI, 2D MRI slice, which is to be examined, say this is our actual image, which is having a dimension of 256 cross 256. If we plot the pixel distribution histogram, say it will look like this. Okay, the complexity of the histogram or complexity of the image can be identified by computing the maximum value of the pixel which is existing in the threshold. Say now I have doubled the image 256 to 512. Okay, then the visibility of tumor remains same. Visibility of the tumor remains same, only the image size slightly increases. Okay, the shape of the threshold or histogram looks same, but here if we see the number of pixels which is to be examined, it will increase. Okay, this complexity here, the number of pixels which is to be evaluated will gradually rise when we keep on increasing the dimension. Okay, so at the end of the day, if we do some software based analysis, we may get some result whose result is similar to the result obtained with an image with a dimension 256 cross 256. For example, say we are analyzing something with this image. Here we identified that this section is the tumorous section. Okay, this is the tumorous section. This is the tumorous section for the small image. Okay, but if we take the higher dimension image, that takes more time. Okay, because here the pixel value which is to be directly the computer software will not go and extract the tumor section. Okay, it will evaluate pixel by pixel. Okay, when it identifies some deviation in pixel enhancement, say some pixels looks very enhanced, then it will capture particular image group, pixel group, and it will produce that pixel group as abnormal section. Okay, same thing will be happened when we use small image. Same thing happens when we use higher dimension image, but the only difference is small image, say we can examine the small image with 1 minute, then we need 5 minutes to examine same image with whose dimension is big. That's why it is our duty to fix the dimension of the image to certain level. So 256 cross 256 is a recommended dimension when we do some automated segmentation or machine learning technique. But if it is deep learning, it must be slightly lesser than 256, that is 227 or 224 according to the method which we adapt. The next, okay, here we said that automated evaluation extract the tumor automatically by finding its pixel value. Okay, so if you take this image, the pixel value which we can see for tumor is similar to the pixel value which we can see for the skull section. Hence, in this section, the skull must be removed before it is to be evaluated automatically. So here to extract the skull, we have a program called a skull stripping method. Otherwise, this is also called as threshold filter. That is, we are going to find a threshold. Say this is the image. This is the actual threshold of the image. Here you can see the pixel distribution. Okay. Okay. In this pixel distribution, you please just you see this. This part shows the actual brain. This projection shows the skull which is surrounded by the image. When we choose exactly the threshold, here assume here we are having a separator. The separator separates this section and this section. Then we can achieve that kind of separation. This section gives the skull, sorry, this section gives the normal brain section. Normal means brain with the tissues. This is brain with only skull. Okay, so this kind of thing is called threshold filtering or skull stripping. Okay, we will share. I will share the code through Dr. Ramsar. You can use it. The next, sorry. The next, so these are some other image modification approaches. But in real-time case, you please remember that in every hospital they are having latest MRI equipment. This kind of thing is not permitted in hospitals because the radiologist will record, will continuously watch when recording the MRI. He will provide accurate MRI when it is to be given to the doctor. It's the work of the radiologist. That's why we can use this kind of analysis only for theoretical research. For example, say when we get this kind of image during some MRI recording, or this kind of image during some MRI recording, these two are called abnormal MRI. Abnormal means not clear MRI. Then this must be reconstructed, corrected to a clear MRI. Okay, so this thing not exist in real-time case, because in real-time case we have a lot of softwares which will initially fix and initially provide us pure MRI, that is MRI without any deviation. Okay, this kind of thing only for theoretical assessment. Okay, these things are called a distorted MRI. Distorted MRI can be converted into original MRI using some reconstruction softwares. Okay, this is reconstruction is nothing but just simply adjusting the pixels. Simply adjusting the pixels, we can convert a blurred image into a clear image. Okay, so then this is also another one drawback. MRI associated with some noise, say this is called a salt and pepper noise or some other noise, then this kind of noise can also be removed, okay, to get a clear MRI using some noise filters. Okay, this also not exist in real-time hospital scenario. It is only for our theoretical research. Okay, then pixel level correction. Pixel level correction is a well-known technique which can help us to enhance the 2D MRI into some clear image. Okay, one is CLAHE, histogram equalization and color map attenuation alteration. Okay, so this is the image. When we enhance the image using these approaches, okay, this CLAHE, this is contrast enhancement, color map correction. Okay, according to the need, we can adapt any one procedure. Say here the visibility of tumor is less, here the visibility of tumor is more, in this case as well as this case. But here it is very poor. So we can ignore this method and we can use this or this. Okay, but every approach will have its own merit and demerit. So it's our duty to choose the right method according to some experiment. We have to initially conduct the experiment before fixing the methodology. So this is the threshold of our histogram of the original image, this image. Then when we alter the pixel group, then we can adjust the contrast of the image so that we can enhance the tumor section. This is the tumor section which was enhanced due to some methods. Here method background is adjusting its pixel, contrast stretching or contrast enhancement. Contrast enhancement or stretching can be done with the pixel distribution, altering the pixel locations of the image. Okay, so this is the code. So if you give some image here, that will provide you the image, enhanced image with these techniques: adaptive thresholding, histogram equalization, image adjustment, etc. Okay, so you can practice. I will share the code with sir. The next, edge detection. Edge detection is another one automated technique. In this, we can use this approach to detect the outliers or boundaries of the whole image. Okay, plus the boundaries of the infected section. Okay, we have a lot of filters to detect find the edge. The commonly adapted one is the Sobel as well as Canny, because we can use Sobel as well as Canny or any one of the method, either Sobel or Canny. In watershed approach, I will show some demo in within some 5 minutes. Okay, then this is another one approach, texture. Okay, during the automated evaluation, okay, here we are not going to extract the tumor. Say we have, say, 1,000 images with us. We are going to segregate the images with no tumor, mild tumor, high tumor. Like that, if we want to segregate, say we have thousands of images in some folder, manually checking and segregating the image is a time consuming task. In hospital, it wastes a lot of time. To overcome that, what they will do is they will use some classification software. They will feed all the images into the software, and the software will segregate the images like no tumor, mild tumor, major tumor. So before doing that work, the software must be trained. The software which we develop will be like a child. Okay, so we have to instruct the child. So this is the tumor, this is no tumor. Like that, we have to instruct the software initially. Okay, this instructing the software initially is called training. Okay, then the performance of the software must be verified using a procedure called testing. Then after that, we can give the images which is to be segregated. Then we can find the performance of the software, that is called validation. Okay, during the automated machine learning approach or deep learning approach, we can use some feature extraction procedures. Okay, this is one of the feature extraction procedure. We have some published works with this kind of approach. Here, what we are going to do is we are going to alter the texture of the image using some filter. Okay, the filter will alter the texture using some methodology. Okay, the theoretical background and all will share it as a base paper which you can use for your research. Okay, so here say this is the original image, this is a filter. Okay, the filter will try to enhance or suppress the particular section in order to increase or decrease the tumor value. So here you take the tumor texture is more visible than other section. Here also the tumor texture is more visible. Then after that, it will try to give some features. Then that feature can be used to train the machine learning classifiers. Okay, then this is one approach. This is called a Gaussian filter approach. Same approach here we are using with some other technique called binary patterns. Okay, LBP, local binary pattern. So here what we are going to do is here we are going to convert the actual grayscale image into binary patterns. Okay, using some global weights. Okay, so according to the global weight, the texture as well as pixel level of the image will be changing. Then this changed texture as well as pixel level help us to extract around 59 features. Okay, LBP image means it try to give 59 one-dimensional feature. It can be represented as 1 cross 1 cross 59. Okay, from one image. From one image, we will get 59 feature. Okay, if we have more number of local patterns by simply changing some weights, we will share the paper. If you read the paper, you will come to know the background or basic of the LBP. By simply changing the various weights, we can develop various patterns of LBP. From every pattern, we can get 59 features. That feature can be used to train the classifiers of machine learning system. Okay, this is the LBP pattern. It is its threshold level. The next signal level analysis of image. During the signal level analysis of the image, here we are going to extract the frequency component from the image, say F1 first frequency component, second frequency component, and third frequency component. These frequency components are used to get some insight. Insight means some interior information which is existing in the MRI slice. Here, we are not at all. If we directly extract the tumor and if we analyze the image according to the tumor, that is called traditional evaluation procedure. That is more time consuming because each and every time we have to identify where the tumor is available, then what is the dimension of this tumor and what is the location of the tumor, like this thing. These things must be evaluated because instead of this, if our tumor is available at the center there is a major brain region part is called the corpus callosum. If any tumor is there, that will destroy or that will severely affect our memory system, memory as well as behavior. Okay, so that's why The exact location of the tumor can be done using segmentation approach. If we want to classify the image into some various classes like no tumor, mild, high tumor, then we don't need to go with the traditional tumor extraction technique. During that time, we can stick with only the feature extraction. Okay, so here spatial filtering. Okay, I will share you the paper as well as code. There you can find the theoretical detail. The facial filtering can be used to get the frequency-based information of the image. Okay, here we have extracted only three frequency information. Okay, according to your need, we can increase the number of frequency component so that we can increase the number of output images. Okay, this is the first frequency component, second frequency component, third frequency component. Okay, so this is one approach which can help us to get the feature like the LBP. Okay, here also we are interested in getting the feature Gaussian filter. So from this image, we will extract the feature. Then that feature can be used to train and validate the classifier. Here also from LBP, we will extract 59 features, one-dimensional features that can be considered to train and test the classifier. In spatial filtering, we can try to extract features from each and every image. Okay, it depends on the methodology. If we need an entropy feature, we can extract, or some other feature we can choose. The next, the DWT. This is one of the widely adopted methodology to extract the feature of the image. It is the one interesting topic in image processing. In DWT, what they will do is they will take one simple image. Okay, the simple image, one-fold DWT means the single image. Okay, say that its size is 100, length 100, width. Okay, a single image will be divided into 4 sections. Okay, then this will be evaluated separately. That is, I'm talking only about not we are dividing the image, it's a dimension. So here, if you take our original image, this image, say it is 256 cross 256. So if you take this image, same image, 256 by 2 will be the dimension. Okay, this dimension will be half of its original image. Okay, this is also half of its original image. It's like dividing, that is size wise, dividing one image into 4 sections. This is the approximate component, horizontal component, vertical component, and a diagonal component. Here they will do some mathematical alteration in image pixels so that a single grayscale image can be obtained, can be used to get this image, this part, and this part, and this part. Actually, here we used a color map called Parula. That's why here, sorry, this is Parula and this is HSV. Okay, due to this color map only, it looks like a RGB image. Actually, we used grayscale image in order to show, because in grayscale, if we see this sections, it will not look visible. Okay, it will be like a grayscale, a plain background. That's why we used some other color map to demonstrate its visibility. Okay, so these things, the theoretical, to analyze the theoretical background, will share you some basic papers as well as code which you can explore yourself. Okay, so here the necessary images for MRI database, necessary MRI database image for research can be obtained from these locations. First is academic torrents, where you have a lot of database kept for research purpose. There you can choose your own data, you can download it and you can use it. You can find both the 3D as well as 2D data set there. Then another one is a cancer imaging archive. Then here, if you want to download some image, you please try to contact me, because initially we have to download some software. Okay, we have to download some software. It is given in that website. If you visit that website, you can find somewhere else, you can find this tiny location. There they may give some introduction like this software must be downloaded to download the image. First you download the software, Then after that, through the software, if you run the particular file, then you can download the image which is related to that particular file. Otherwise, if you want to access more number of, not only MRI, if you want to access more number of medical images, then you can visit the website called grandchallenges.org. That is one of the premier website. There you can find the major requirement of hospitals per year. Okay, every year they will post some competition. The competition detail can be found there. Now I'm going to run one MATLAB code, okay, to demonstrate how the algorithm works. Then I will share you the result. I already shared a code with Dr. Ram sir. You can get it from him and you can run and you can have a practice. Okay, so here we used Brat's data test, that is a brain imaging segmentation data set. Okay, here the procedure which we implemented is as follows. Okay, so we collected 3D image from some location, that is Brat's data location. From there we collected 3D image. Then with the help of ITK software, we converted 3D image into 2D slices. Okay, then from every 2D slice, our aim is to extract the tumor section with appropriate accuracy. Okay, so this is the tumor section which is to be extracted. Here, in order to extract the particular tumor, say this is the tumor, this is tumor, this is tumor. In order to extract the tumor, here initially we have enhanced the tumor section using Kapur's entropy thresholding. Okay, so which can be the thresholding can be done with any approach. Whatever algorithm you have, you are familiar with heuristic algorithm. Okay, you can use that algorithm to find optimal threshold using Kapur's method. Because entropy, it's defined in this image. 1 minute, just 5 minutes, I will complete. In image processing, entropy is defined as identification of the abnormal section in the particular image. So that's why we have a lot of entropy-based thresholding methods, Kapur's, Salis, then Fuzzy, Shannon. There are a lot of approach. But Kapur's entropy, from our earlier work, we found that Kapur's entropy and Shannon's gives better result compared to other approach. Hence, in this method, we adapted Kapur's entropy to enhance the tumor section. Enhancing means when we run this code, this particular region will be visible more than other section. When we do this operation, then this is called as thresholding. After getting the thresholding in the image, if we feed that image into some automated segmentation technique called watershed algorithm, that will try to extract the binary version of the tumor. So this is the extracted binary version of the tumor. Then we have to confirm the betterness of our algorithm. Then in order to confirm the betterness of the algorithm, this extracted tumor section must be compared with a ground truth. Ground truth is nothing but the image given by some disease expert. For example, say doctor. Okay. So when we compare this particular tumor image with the ground truth, then we will compute some basic parameters like Jaccard index, dice coefficient, accuracy, that is pixel level. That is, this is the image, this is the image. Both should be pixel wise compared. That is, say, if we compare one hand with another one hand, okay, index finger must be compared with index finger, like that. Okay, so pixel level comparison must be executed between the images in order to get the value of Jaccard, dice, accuracy. There are a lot of parameters which you can find it in literature. Okay, when we do this, then we'll get some information where we have to check only the accuracy or Jaccard or dice, or all of the accuracy, Jaccard and dice. If these values are closer or greater than 90%, then we can assure that the developed approach works well and it can be used for automatic extraction of tumor. That is, instead of, for example, say if it is some disease center, say there are only 5 doctors, say disease specialty center, only 5 doctors are available, say patients visiting per day is more than 500 or 1000, say cancer center. So for 1500 patient, 5 doctor will not be sufficient. That's why we can develop some software methodology which can do some initial analysis. Then this outcome can be used to support the doctor, okay, during the further examination. The patients will be called. Okay, so if our tool suggests the patient condition is very sick, then the patient will be given priority. Then along with our software developed report, the patient visits the doctor. Then the doctor once again personally examines the image himself, and he gets the report which was given by the software. Then based on this analysis, the doctor will plan the further treatment which is to be executed for the patient to recover the patient from the disease. So whatever methodology we develop, that methodology will act as some assisting or supporting unit for the doctor. We are not going to replace any doctor. We are going to assist the doctor during the disease analysis. Okay. So here the aim is we have to extract the tumor. After extraction, it must be compared with the ground truth. Then we have to extract the performance measure. So here we have done it for axial weave, coronal weave, and sagittal weave. Okay, this will be the outcome. Now I will show the outcome for a single image. Then after that, we'll wind up the session. Okay, so this is the outcome which we get from the image. From the software. Here first we have to feed the image. The software initially performs edge detection. Okay, it identifies the edges or boundaries, outliers existing in the image. Then after identifying the outlier, the algorithm or software assigns some colors according to the outlier. This is called as watershed fill. Then after that, it will do some morphological operation. Morphological operation means it will try to um, combine the pixel in order to have a particular class. Okay, 2 class or 3 class. Here, if you take, it will be a multiple class pixel in my image. After morphological operation, the pixel groups will be combined together to get some specific pixels. Then after that, the tumor section must be enhanced. Then after that, it must be extracted. After extraction, these two must be compared separately. Then with this comparison, we are going to get the values like a Jacquard dice, accuracy, precision as our final result. This is our final result. These are initial result. Where TP is nothing but in this image, wherever we have white section, that is called as true positive. True positive means that is the tumor section. Then the background black, that is called as true negative. Okay, when during comparing this with this, if we identify white section as black section, then it's called as false positive. If we identify black section as white section, then it's called false negative. Okay, these are the pixel values. Okay, in that whole image, 4024 represents this much of pixel we have for this image. Okay, this white section has 4024 images. Like that we have to assume. Okay, then after computing the pixel, we have to do some mathematical computation. We have some formula. In that formula, if we implement the value, then we can get the value. We have separate formula for Jacquard dice something, true positive, false negative. For everything, we have separate formula. Then the formula will automatically compute the value, and it will try to get us the result. Okay, So with this, I stop. So first, let me do some 1 minute staff member. First, let me give a MATLAB simulation. Then after that, you can have some discussion with me if you are interested. 1 minute. 1 minute. Let me share the code with you. Sorry. Yes. I hope you can see it now. Okay. Here we have modified the existing code. It's readily available in internet. The Mayfly algorithm code I will share you if you are interested. Mayfly is nothing but Firefly algorithm. Okay. So whatever, 1 minute. 1 minute. So here I already shared this code with Dr. Ram sir. Okay, if you are interested to explore the code, I request you to get it from Ram sir and you explore it yourself. Okay, if you want to modify the code, I will help you to achieve it. 1 minute. Now we are going to execute the code for some brain image. Okay. 1 minute. Yes. Because here for this code, we have to give the test image as well as the ground truth correctly. Otherwise, the result may be wrong. Yes. Now I have given. Are you able to see this code? Some of you please confirm so that I can run it.
Yes, sir. We can see.
Yes, sir. We can see it.
Yes. Yeah. Thank you, sir. Thank you. So now you please listen, sir and ma'am. The second line. Here we have to give the image which is to be processed. Here level is nothing but the threshold level, which you can fix. You can start from 2, 3, 4 like that. You can trial and error. That is program line 4. You can make your trials. First you start with 2, start with 3, start with 4 like that. Then you check the outcome which you receive in your command window. If you are getting outcome more than 90%, then you can fix your level. Initially you have to try. You have to make some trial. After getting the result, you can fix that level as a constant. Simply you have to keep some in loop. Just you in folder say 100 images, main image, 100 ground truth image. In both are in some separate folder. Then from that folder you can call one main image, its corresponding ground truth. You can do the analysis. You can store the result in Excel. Okay, like that. If you can perform, then you can implement segmentation, automated segmentation for some brain MRI. 1 minute, sir. Let me, yeah, now it's 1 minute. Yeah, it's not, it's PNG. 1 minute. Okay, in program number line, that is second line, you have to give the input image. Similarly, in 76 line number 76, we have to give ground truth. Yeah, now it's running. Let us wait. If image dimension is small, if it is image as grayscale, we can get output immediately. If image dimension is more, if image is RGB, then also we will get output. But only the difference is it takes more time. Okay, 1 minute here. sensitivity, everything is good. Accuracy, it's less 1 minute. Here, one more line may be added. Okay, the working code, I will share it now. Okay, after fixing the code, I already shared one code with sir. 1 minute. Yes. It extracts exactly. Only thing is, yeah, I think now it will work. Here I request your kind permission to know what are the images which you can see now. Can you see the whole window, or can you see all the images?
Yes, sir.
Yes, 1 minute, sir. Then I will run once again. Then I will explain. So here I have slightly modified the code. Here I think you can see the dice are very less. Accuracy slightly improved to 80. Precision is less. Sensitivity 100. I will fix the code and I will send it now with through Ramsar. You can run. Only thing is just simply here we can fix our level. That is keep on level 1, level 2, level 3, level 4, like that. We have to gradually raise the levels of threshold. Here you can check. Okay. Here this is this white section. Can you see it, sir?
Yes, sir.
Yeah, this is the tumor. This is wrongly identified because the tumor must be the whole thing. Okay. It is the wrongly identified tumor. Say this is the original image. The whole section is our tumor now. Okay, the whole section must be extracted. Till it is extracted, um, we have to keep on increasing the levels. Okay, simply if we can change the levels of our thresholding, that is, it's a multi-level thresholding combined with the watershed algorithm. If we keep on changing the level initially only one time, then it will be possible for us to get the best accuracy. After getting best accuracy for one image, we can fix the same thing for other image also. So now I hope for level 4, I think it's giving same thing. I will fix it and I will send it later. That is today I will share it. So this is the original image. Here the various sections. This is the original image where the tumor is to be extracted. First, we are detecting the edges using some edge detection algorithm, which is available inside the watershed technique. Then after that, according to the detected edges, we are going to fill the colors. This is called as a watershed fill. Then after that, we are going to apply some morphological enhancement. The morphological enhancement initial level. This is initial level. This is the morphological enhancement, the final level. So if we check inside, we can have a plane surface. One surface shows the tumor, second surface shows the brain sections. Okay. Then after that, here we can see, here we have some holes, tiny holes in a morphological image. Then after that, we have to further, we can enhance it using additional morphological technique. Then after finally, if we check the image, here we can find two sections. One is the normal image section. Another one is the tumor which is to be extracted. Then the tumor which is to be extracted must be enhanced. That is pixel level of the tumor must be enhanced. After enhancement, it must be separated from the image. So this is the extracted tumor. This extracted tumor must be compared against the binary version of the ground truth image. After the comparison, we'll get the informations such as dice, accuracy, precision, sensitivity, FN score, negative predictive value, these things. Okay, it's a single, it's a single software based on MATLAB. Simply, if you can give the images at line 2 main image. Then after that in line 4 you have to choose the level. In line 76 you have to give the ground truth. If we do this perfectly, then if you run in command window, we can find some performance measure. The performance measure must be we have to check the performance measure. If its value is greater than 90, then we can stop. Otherwise we have to adjust the level of threshold. That is in line 4 there is called a level 2, 3, 4. Like that, if we have to keep on increasing in some level, we will get a good result. Okay, after increasing the level, once again we have to run. Once again we have to come and check the command window. Okay, in some level, say we are getting accuracy or Jacquard or dice which is nearer to 90, then we can stop adjusting the level. Then only thing is in line 2 we have to give input image. In line 76 we have to give appropriate. For example, say input image slice 20 means the ground truth also must be slice 20. Same thing we have to give. Then we have to do the procedure. We have to make a tabular column. In tabular column we should have the value of true positive, true negative, so and so, which we discussed in our slide I already shared with Dr. Ram sir. You can get it from him. Similarly, for other codes and all, I will try to share on Wednesday. So I kindly request your permission to stop this session. So if you need any other suggestion, you can provide me so that I can correct my mistakes. Similarly, if you need any other code, you can contact me through Ramsar, or you can directly contact me after the FDP. But on Wednesday, what are the possible codes which I can provide regarding this session? I can share it with you through Dr. Ramsar. Okay, thank you very much, everyone. Thank you very much.
Any
Sir
participants
Ramsar,
want to ask
yes.
any question? Any participants would like to ask any question? Okay. I would like to thank Dr. V. Rajnikant sir for delivering
Yes, sir.
and enlightening us with their knowledge. He has started from very basics
Yes,
that a
sir.
person with zero knowledge of MRI medical image segmentation has understood so well. Session
Yes,
was full
thank you,
of
sir.
knowledge and interesting facts,
Yes,
especially
sir.
the points when Dr. Rajnikant sir told about how medical image technique is selected based on the diseases and infected sections of the body, methods of preparing the patients for MRI, the open source software ITK Snap for 3D to 2D conversion, and different methods of MRI enhancement. I am pretty sure that this previous knowledge that Rajnikant sir has gave us will definitely help a lot in our research, and it may also help in our daily life.
Yes, thank you,
And
sir.
at last, I would
Thank you,
like
sir.
to thank our participants for their kind cooperation. Thank
Yes,
you,
sir.
sir.
Yeah, thank you very much, sir. Thank you very much, everyone. Thank you very much. If you want to give some suggestion for my improvement, you can give. Okay, otherwise, if you need need code, exact code which we discussed today, I request you to wait till Saturday, because I have to work once again. I have to verify all the code, because now you found that I got some mistake which immediately I cannot correct. Okay, it's working, but I changed some image. That's why it's showing some error, but it gives up to 80% accuracy. I will fix it immediately. Today, I will share it with you through Dr. Ram sir, which you can you can try yours. Along with that, I also share some 3D images, which you can try to open in ITK Snap, and you can try to store it as a 2D, etc. You can learn, you can have some practice. Then it will be useful for you to do not only with MRA, even if you have a CT image, if you have CT image of COVID-19 or something else, you can use same methodology to evaluate the particular image. I will share some images through Dr. Ram sir. Okay, thank you very much for your patience. Thank you very much for inviting me. Thank you very much. Have a nice day. Thank you, sir.
Thank you,
Thank
sir.
you, sir. Yes, sir. Thank you, sir. Can I leave, sir?
Yes, sir.
Yeah. Thank you very much, all. Thank you very much. Bye, sir.
Okay. Okay, I request all the participants to leave and join tomorrow at 10 a.m. Thank you all.